Addison's disease is a rare disorder that affects the adrenal glands. These glands are small, triangular-shaped organs located on top of each kidney. Despite their size, they play a crucial role in maintaining various bodily functions. The adrenal glands are responsible for producing several important hormones including cortisol and aldosterone. Cortisol helps the body respond to stress, maintain blood pressure, and regulate metabolism. Aldosterone, on the other hand, helps control blood pressure by managing the balance of sodium and potassium in the blood. These small glands sit atop your kidneys and play a vital role in your body. They are essential for producing hormones that regulate many of our body's critical functions. They produce hormones including cortisol and aldosterone, which are essential for life. Cortisol helps the body respond to stress, maintain blood pressure, and regulate metabolism. Aldosterone helps control blood pressure by managing the balance of sodium and potassium in the blood. In Addison's disease, the adrenal glands don't produce enough of these crucial hormones. This insufficiency can lead to a range of symptoms, such as chronic fatigue, muscle weakness, and weight loss. This deficiency can lead to a variety of symptoms and health problems. Patients may experience low blood pressure, salt cravings, and even darkening of the skin in certain areas. These symptoms can be quite debilitating and significantly impact daily life. It's important to understand this condition, as early diagnosis and treatment are essential for managing it effectively. With proper medical care, individuals with Addison's disease can lead normal, healthy lives. Treatment typically involves hormone replacement therapy to correct the levels of deficient hormones. Addison's disease is often caused by an autoimmune disorder. In these cases, the body's immune system mistakenly attacks the adrenal glands, leading to their dysfunction. In these cases, the body's immune system mistakenly attacks the adrenal glands. This autoimmune response is the most common cause of Addison's disease, but it is not the only one. Other causes include infections, tumors, and certain medications. Infections such as tuberculosis can damage the adrenal glands, while tumors can disrupt their function. Certain medications can also interfere with hormone production. While it is relatively uncommon, Addison's disease can affect people of all ages and genders. It does not discriminate and can be diagnosed in anyone, regardless of their background. However, it is most often diagnosed in adults between the ages of 30 and 50. This age group is particularly susceptible, and awareness is key to early detection and treatment. The adrenal glands are small, triangular-shaped glands located on top of each kidney. Despite their small size, these glands play a significant role in maintaining overall health and well-being. They are part of the endocrine system, which is responsible for producing and regulating hormones in the body. These glands produce a variety of hormones that act as chemical messengers, influencing numerous bodily functions and processes. Among the many hormones produced by the adrenal glands, two key ones are cortisol and aldosterone. These hormones are essential for managing stress, metabolism, and maintaining the body's salt and water balance. Cortisol, often referred to as the stress hormone, is crucial for helping the body respond to stress. It also plays a role in regulating blood pressure, blood sugar levels, and the immune system. When the body encounters a stressful situation, cortisol levels rise, providing the necessary energy and alertness to handle the challenge. Additionally, cortisol helps in the metabolism of carbohydrates, fats, and proteins, ensuring that the body efficiently converts food into energy. Aldosterone, on the other hand, is vital for maintaining the balance of salt and water in the body. It acts on the kidneys to regulate the amount of sodium and water retained or excreted. By controlling the balance of these essential elements, aldosterone helps maintain proper blood pressure and hydration levels. This delicate balance is crucial for the body's overall function, ensuring that cells receive the right amount of nutrients and oxygen. In summary, the adrenal glands, though small, have a profound impact on our health by producing hormones that regulate stress, metabolism, and the balance of salt and water in the body. Addison's disease often develops gradually, and its symptoms can be subtle at first. This can make it challenging to diagnose in its early stages. Common early symptoms include fatigue, muscle weakness, and loss of appetite. You may also experience unintentional weight loss, nausea, vomiting, and diarrhea. These symptoms can be mistaken for other conditions, leading to delays in diagnosis. As the condition progresses, other symptoms may appear. These can include darkening of the skin, especially in areas exposed to sunlight or friction. You may notice salt cravings and dizziness or lightheadedness when standing up. Some individuals experience abdominal pain, depression, and irritability. It's crucial to remember that symptoms vary from person to person and not everyone experiences all of them. In some cases, Addison's disease can lead to a life-threatening condition known as an adrenal crisis or Addisonian crisis. This occurs when the adrenal glands suddenly stop producing enough cortisol. An adrenal crisis is a medical emergency and requires immediate attention. Recognizing the signs and symptoms is crucial for prompt intervention. Symptoms of an adrenal crisis often appear suddenly and worsen rapidly. They can include severe fatigue, weakness, and confusion. You may experience severe abdominal pain, vomiting, and diarrhea. Other symptoms include low blood pressure, dehydration, and loss of consciousness. If you or someone you are with experiences these symptoms, especially if you have Addison's disease, seek immediate medical attention. Section 5. Diagnosing Addison's disease tests and procedures. Diagnosing Addison's disease is a multi-step process that requires a thorough understanding of the patient's medical history, a detailed physical examination, and a series of laboratory tests. Diagnosing Addison's disease involves a combination of medical history review, physical examination, and laboratory tests. The initial step often includes a comprehensive review of the patient's medical history to identify any symptoms that may suggest adrenal insufficiency. Your doctor will ask about your symptoms, their duration, and any other medical conditions you have. They will be particularly interested in symptoms such as fatigue, muscle weakness, weight loss, and changes in skin pigmentation. They will also check your blood pressure and look for signs of skin darkening. Low blood pressure, especially when standing, and hyperpigmentation of the skin are common indicators of Addison's disease. Blood tests are essential for confirming the diagnosis. These tests help to measure the levels of critical hormones in your blood, providing valuable information about your adrenal function. Blood tests will measure the levels of cortisol and adrenocorticotropic hormone, or ACH, in your blood. Cortisol is a vital hormone produced by the adrenal glands, and ACTH is a hormone produced by the pituitary gland that stimulates the adrenal glands to produce cortisol. ACTH is a hormone produced by the pituitary gland that stimulates the adrenal glands to produce cortisol. Understanding the relationship between these hormones is crucial for diagnosing Addison's disease. Low levels of cortisol and high levels of ACTH often indicate Addison's disease. These hormone levels provide a clear indication of adrenal insufficiency, which is a hallmark of the condition. Your doctor may also order other tests to determine the underlying cause of the condition. These additional tests can include imaging studies such as CT scans or MRI to assess the size and shape of your adrenal glands and to look for any abnormalities. Section 6. Treatment strategies for Addison's disease. The primary treatment for Addison's disease is hormone replacement therapy. This involves taking medications that replace the cortisol and aldosterone that your body is not producing in sufficient amounts. These medications are typically taken orally, in the form of pills. It's important to take these medications exactly as prescribed by your doctor. Your doctor will work with you to determine the appropriate dosage of hormones based on your individual needs. Regular monitoring of your hormone levels is essential to ensure that you are receiving the correct dosage. In some cases, you may need to adjust your medication dosage during times of stress, illness, or surgery. This helps prevent an adrenal crisis. Section 7. Living with Addison's disease tips for management. Living with Addison's disease requires careful management to maintain your health and well-being. This includes adhering to your medication regimen, monitoring your symptoms, and making healthy lifestyle choices. It's also essential to be prepared for emergencies, such as an adrenal crisis. It's crucial to wear a medical alert bracelet or necklace that identifies you as having Addison's disease. This will alert medical personnel to your condition in case of an emergency. Carry an emergency injection kit with you at all times. This kit contains injectable hydrocortisone, which can be life-saving in an adrenal crisis. Make sure you and your loved ones know how to administer the injection. Section 8. The importance of early diagnosis and treatment. Early diagnosis and treatment of Addison's disease are essential for preventing complications and improving long-term outcomes. When left untreated, Addison's disease can lead to a range of health problems, including dehydration, low blood pressure, and electrolyte imbalances. It can also increase the risk of an adrenal crisis. Timely diagnosis and treatment can help prevent these complications and allow you to live a full and active life. Hormone replacement therapy can effectively manage the symptoms of Addison's disease, improving your energy levels, mood, and overall quality of life. Regular monitoring and follow-up care with your doctor are crucial for ensuring treatment success. Section 9. Seeking help and information. Your path to wellness. If you are experiencing any symptoms of Addison's disease, it is crucial to seek medical attention promptly. Early diagnosis and treatment are paramount for managing this condition effectively. Your doctor can perform the necessary tests to confirm the diagnosis and initiate appropriate treatment. Don't hesitate to ask questions and advocate for your health. Remember that you are not alone in this journey. Support groups and online resources can provide valuable information, connect you with others who understand your challenges, and offer emotional support. Living with a chronic condition like Addison's disease can be challenging, but with the right knowledge, support, and medical care, you can live a full and rewarding life.